Mrs. Smith. My name is Lisa. I'm going to be your nurse for this afternoon. May you please state your name and date of birth? All right, thank you. Mrs. Smith, do you have any allergies to chlorhexidine, iodine, latex, or shellfish? No? Okay. I'm going to go ahead and close this curtain to provide you with some privacy. Ms. Smith, your doctor has ordered me to do a Foley catheter insertion today to relieve your bladder distension. As soon as your bladder distension is relieved, we will go ahead and remove the Foley catheter. In order to perform this procedure, I will have to expose your genital area and clean your genital area. Do I have permission to do this? Okay, thank you so much. I am now going to ask if you have any questions for me before I begin the procedure. No? Okay, well, if you have any questions during the procedure, please stop and let me know, okay? Okay, I'm now going to start the procedure by doing hand sanitizer or hand hygiene. I'm going to gather my supplies and put them onto my workstation, which is clean. I am going to don a pair of clean gloves. I am now going to raise the bed to my hip level. Mrs. Smith, I am now going to expose your genital area. I'm going to palpate her stomach to check for bladder distension. I will then check her peritoneal area for any redness, swelling, rash, lesions, or skin breakdown. I will then continue to move her covers down to the edge of the bed. I will now ask her to flex her knees upward and to drop her knees outward, and I will assist her with this. Okay, I will now lower the bed rail and lock it into place. I will remove my gloves. I will lower the bed rail. I will adjust her head position so that she is in a supine position for when I begin the procedure. I will now remove my gloves and dispose of them. I will perform hand hygiene. I will now remove my kit from my packaging. I plan on using the outside wrapper as a garbage bag. I'm now going to reposition my kit. I'm going to open the first flap out and away from me, my second flap to the right, my third flap to the left, and lastly, my fourth flap towards me. I am now going to reposition my sterile field so that I have room. I am going to remove my sterile drape, keeping in mind that I need to stay within my 1-inch margins. I am going to place the sterile drape shiny side down. I will go back to fix my sterile drape once I have my sterile gloves on. I will now begin to don my sterile gloves, lifting up on the lips of the paper, folding back behind the gloves and underneath the gloves to ensure that the flap doesn't open during the sterile gloving and contaminate the gloves. I am now going to start by picking up the folded portion of the glove, and I am going to insert my dominant hand, making sure that I pull back on the wrist so it doesn't slide across to my wrist. I will then let go. I will go back in with this hand and I will lift up the other glove using the fold. I will insert my other hand, keeping my thumb on my gloved hand away. I will insert my hand, pull down, and snap. I can now go ahead and fix my gloves. I don't intend on fixing the wrist portion of my gloves. I am now going to remove the top portion of the kit and place it into my sterile field. I am going to remove the cap from my saline and dispose of it. And I'm going to place it back in the top portion of the kit. I am then going to remove the top portion of my syringe, dispose of that, and place that back into my sterile field. I will then take the saline and I will connect it to the port of my catheter. I will remove the portion of the catheter that will be inserted into Mrs. Smith, and I will remove it from its wrapper, making sure that it never flops over, and I will dispose of the wrapper. I will take the lubrication syringe and I will insert the catheter into the lubrication, and I will set it back inside of my box. I will then reassemble my kit. I will put my top portion back on. I will remove my tongs and I will remove the iodine solution, and I will pour the iodine solution all over my cotton balls. I will step back and dispose of the iodine. I will replace my tongs. I will then come over here and make sure that my sterile drape is in position, which it is, making sure that I stay within my 1-inch margins. I will then take my Foley catheter kit and I will place it in front of Mrs. Smith. Mrs. Smith, you are now going to feel my touch. I am now going to spread Mrs. Smith's labia minora. I will begin the procedure by taking a iodine-soaked cotton swab, and I will wipe from clitoris to anus, first on the side that's facing me. So from clitoris to anus, I wipe that. I am going to go around, making sure I don't go over my sterile field, and I will dispose of the cotton swab. I will then grab my second cotton swab, and on the other side, I will swab from clitoris down to anus. I will come around again, not going past my sterile area, and I will dispose of the cotton swab. I will then take my third cotton swab, and I will wipe from top to bottom, so from clitoris down to anus. I will dispose of this, I will dispose of my tongs, and I will dispose of the top portion of my kit. I now have to make sure that Mrs. Smith's labia minora does not touch, or I will have to begin the cleaning procedure all over again. I will now remove my catheter from the lubrication. Mrs. Smith, if you could just please bear down, you're going to feel some pressure. I will now insert the Foley catheter into her urethra. When I see a flash of urine, I will insert the catheter another 2 to 3 inches. With my hand that is holding her labia minora, I will pinch the catheter. I will come over here with my sterile hand and I will begin to insert the 10 cc's of normal saline to fill the balloon. Once I am done, I will remove the syringe and I will dispose of it. I will then go ahead and tug on the catheter to make sure that it's in place. It's nice and secure, so now I can move on by grabbing the rest of the catheter bag. I will place the portion that I plan on taping to her leg over here, and I will take the catheter bag and attach it to the side of her bed, making sure that the bag is below catheter level and that it will not be moved. I will then dispose of all of the equipment that I just used to perform the procedure, and I will dispose of it in the proper bin. I will then remove my gloves. And I will dispose of them. I will perform hand hygiene. I will then get a piece of tape ready, and I will don a pair of clean gloves. I will then take the piece of tape and I will tape the Foley to Mrs. Smith's leg to secure the catheter. I will then decide whether or not her peri area needs to be cleaned to remove any excess iodine. It doesn't look like she needs any extra cleaning. I will now reposition the patient to make her comfortable. I will then raise her side rail back up and make sure it's locked and secured. I will lower her bed all the way down to the lowest setting that it can go, and I will raise the head of her bed back to normal position. I will then remove my gloves and I will perform hand hygiene. Mrs. Smith, are you feeling any kind of discomfort after the procedure? No? Okay. So do you have any questions for me? No? Okay, well if you do, or if you are feeling any discomfort, here's your call light. Please let us know if you're feeling any discomfort, if you have any questions, anything at all. If you need anything, please let us know, okay? Your doctor is going to be in with you in a couple minutes to discuss the procedure and then the next steps. Is there anything else I can do for you before I leave? No? Okay, well thank you so much for letting me perform this procedure, and I will see you in a little bit, okay? Get some rest. Thank you.